Well, surgeon Dr. Ahmed Gilani is there, and today I am going to demonstrate the hernia mesh placement terminology. It's taken from the EduSearch clinics. I don't own copyrights thanks to the small talk series. It's just for the educational purpose. So first of all, you must be able to understand this diagram where I am showing the skin. Then you have got the camper fascia. Then you have got the D fascia, then you have got the anterior rectus, then we have got the posterior rectus, then we have got the rectus abdominis muscle, and here external oblique is there, and then at this point external oblique aponeurosis is there. Then you have got the anterior layer of the internal oblique aponeurosis. This dotted line, actually this is the scarpa fascia. This is the fascia transversalis. This black line, this is the peritoneum, and this solid line, this is basically linea semilunaris. Okay, and here in the middle, this is the linea alba. So you must consider and memorize this diagram. Here the posterior rectus sheet is formed by the transversalis abdominis aponeurosis and posterior layer of the internal oblique aponeurosis. So I hope this is clear till now. Now we are going to discuss if we place the mesh anterior to the anterior rectus and behind the deep fascia, here shown in the black line which I am now marking as red. This is the onlay mesh placement. So now if the mesh is covering the defect exactly at this point, then it will be known as the inlay placement of the mesh. Then we have got this position. This is the intraperitoneal or onlay mesh placement. It is also known as the intraperitoneal onlay mesh. Most of the time we use this in the laparoscopy. Now we have got the retrorectus position, that this is the rectus abdominis muscle, this is the rectus abdominis muscle, and just behind the rectus abdominis muscle and anterior to the posterior rectus a mesh is placed, and then medial to the linea semilunaris. This position is known as the retrorectus position of the mesh placement. Remember this diagram. Later we will discuss the retromuscular after transverse abdominal release from this point. So now the transversalis fascia has been released at this point, and now we can extend the mesh just behind the rectus to just behind the transversalis fascia, transversalis muscle. So it's behind the two muscles, that the rectus abdominis and the transversalis abdominis. So this position is known as the retromuscular placement of the mesh. Now previously we have studied that there is a retrorectus position. In the same way, the anterectus position is also there. When you place the mesh just behind the anterior rectus and just above the rectus abdominis muscle, exactly at this point, it will be known as the anterectus placement of the mesh. Now this is the transversalis fascial plane. Here in the black it's shown, which I am now marking with red. Now we have got this position just behind the, you can say that, external oblique and just above the internal oblique. This is the internal oblique placement of the mesh. It's lateral to the linea semilunaris, where this is the linea semilunaris. Okay, then you have got the retro oblique placement of the mesh exactly at this spot. Again this is lateral to the linea semilunaris. So to summarize this, onlay mesh which is anterior to the rectus sheath, inlay mesh bridging the defect or a sheath. Previously it was known as the interposition mesh. Now retrorectus anterior to the posterior rectus sheath, pre-peritoneal which is posterior to the fascia transversalis, and then intraperitoneal onlay mesh which is posterior to the peritoneum, that's the sublay underlay, previously it was known. And there are some rare inter-oblique, retro-oblique, retro-muscular after transverse abdominal release, and then anti-rectus. So thank you so much for watching this video. Hope you have understood something from our video. Thank you so much.